Good morning, everyone who is watching from the commodity of your home. This is another Friday with Dr. Munné. We're having coffee with Dr. Munné, and this is an amazing day after a few couple of weekends, right? Dr. Munné, we are back with more good information about your dental health. And today we are going to talk about, we're going to continue the series of implants and we're going to talk about implant complications. So here we have Dr. Muneg with us. Thank you, Dr.
Yes,
Muneg.
absolutely. Thank you, Adrian. Good morning, everyone. Thank you for tuning in. And I like to continue on the topic of implants because I think it's important that we have good information about it. And, you might hear some patients that say, well, I had a bad experience with an implant or something happened. Today, we'll talk about one case. I want to utilize the experience of one case, what happened with that particular patient, and we can analyze and follow the steps and see exactly what happened. So we're going to start by placing our first slide on the screen. This is a patient of a single implant. So, when we're placing only one implant, not necessarily is like, easy. It can be easy if it's done right, but it's important that all the um, steps are followed carefully. So you can see in this case that there's one implant. This is an implant on the upper left area. So you see that the implant is the long part of the tooth. That's let's say the artificial root, and then there's actually a crown on top of it. That implant was placed at the general dentist office, and the patient was fine for some time, and didn't have any problems. We can see that on your left side of the screen, that actually is the part of the implant that connects with the palate bone, the bone that's on the roof of your mouth. The top of the implant, on the very top of that x-ray, is the sinus, is our sinus cavity. And you can see that's darker because it's an empty space. There's air over there. And then on the front of the implant, there's actually a dark area. There's a little concavity on the bone. You can see the bone, and I don't think I can um, can we with the can you do with a mouse? Yeah, thank you. So let me use the mouse, and that way you guys can see. So all this is an area of bone loss. So the bone on the patient actually had been lost all the way to the front. So the reason why the patient came to me is because he had an infection. There was an infection. There was like some drainage coming from the front of the implant, and there was a very deep measurement. So you can see the bone. I'm going to show the bone right there. That's remaining bone, but the infection came from this side. What I want to attract your attention to is a little bit like the angle, the angulation of that implant. So the implant we know is the artificial root. So the implant is placed more towards the palate. It's really not centered in the bone. The bone, or what we call the ridge, the alveolar ridge, it goes from the palate all the way to the front area or the cheekbone. And right in the middle, we should have placed our implant. Now, because this implant was placed more towards the palate, then the crown has like a wing here in the front. So what happened is that this wing kind of puts pressure every time that the patient bites on this area, and there's a flexion that goes towards that side. So we access the area. We're going to go, Adrian, to photo number 2. We access the area. I'm going to show you a photo of the surgery, and you can see that in here, when we cleaned up, that's after cleaning the infection, we see that there's a line. So this line is a fracture. So the implant actually cracked. That's something very uncommon. So I don't want you to think that this is a common problem. Implants don't fracture frequently. Is a rare occasion that they crack, but they can crack. And in this case, it cracked because the forces that were placed on the crown. If you see, the crown here is very long. Usually the implant, when it's placed right in the middle of the bone, has more of a smooth transition into the crown instead of a flat wing. When we go to the next x-ray, this is actually, we had removed the implant. You can see that the bone was attached. You can see all the white is bone. And right in the middle of the fracture line, you can see that the bone was lost. I want to note that also there was bone loss all the way around it, about this area. So we had lost bone around in a circular way and then on the front. So there was only a little bit of bone holding the implant, but the problem is that the implant was fractured. If the implant is cracked, cannot be fixed. It has to be taken out. Now, if the patient only had bone loss, I could have gone, cleaned the infection, and build up the bone. But in this case, this was not an option because, as I mentioned, once the implant is fractured, it's actually hopeless. So on this case, what we did is that we extracted the implant and we placed bone graft. I'm not going to show you any bloody photos, so don't worry. I'm just going to show you this x-ray. You can see this is the x-ray of the patient, and right here is where we took the tooth out. You can see that we built up the bone where the extraction was, so that has been regenerated. We also, I am missing one photo, but that's okay. I had a photo of the how the gum looks from the top. And but then what we did is that in order to place another implant, we need to correct and make sure that everything is ideal. So on placing the implant, we corrected two things. One, we corrected the placement of the implant, making sure that the implant is placed in the correct position, right in the middle of the ridge, from the front to the back, and in between the teeth. So it's got to be completely centered. We also made sure that we had sufficient bone. So instead of putting an implant that's shorter, since that puts more torque, more flexibility, right? And because the patient, those implants on the back, they actually have more forces when we bite than if it's an implant on the front. So we have to make sure that we have sufficient surface around the implant to withstand that trauma every time that we bite. So in that case, what we did is that we placed a longer implant. Well, how are we going to place a longer implant if we have the sinus cavity, right? We saw on that first x-ray that I showed you that the sinus cavity is right here, right at the edge of the implant. So in order to place a longer implant, what I need to do is that I need to do a procedure called sinus graft or sinus lift, where I build bone inside the sinus, and then from here we actually can place a longer implant. And that's what we did. And I'm going to show you just after we did the sinus graft. You can see the little bump right here. So this is the sinus floor. You see the darkness, and there's a little bump. This is the palate, and this is the front. You can see the implant now is centered in the bone and also is centered in between the teeth. You can see the bump on top, all around the roots. So that's how we have bone all around the implant. Don't worry about this darkness. This is like a scattered radiation because of the implant has a lot of metal, but we do have a lot of bone. So everything was totally connected with bone, as you have been able to see on this x-ray here. So something that is very important, can we have, I go back here now. So something that's very important in order to achieve this is good planning, right? And in order to do that, we use surgical guides. Those surgical guides, those are reports when we fabricate this. So this is actually a guide that has holes, and it tells me exactly where the implant has to go. So you guys can see that there's little holes in here that fits in the whole teeth. It cannot move, and it gives me the angle on the tooth. And we have all these reports that are generated with the surgical guide planning team That's going to tell us, and then we have notes, all the instructions where the implant has to go in order to have proper placement. So not because it's just only one implant, you know, all the steps are not taken. All the steps have to be taken in order to make that implant successful. So now this patient has the area regenerated, the infection has been taken care of. We placed a longer implant in an ideal position. So that's going to give us a good emergence of profile. And then the crown, instead of looking like a one-sided mushroom, is going to look really like a nice tree, that has all the branches centered within the roots. And that's going to be like how we're going to guarantee, longevity on that implant. Of course, the one I'm going to say, all that accompanied by good oral hygiene and a good maintenance and prevention program. Make sure that this patient has regular checkups, that everything can be maintained and prevent that it gets so far. And that's how we can make implants successful, because implants are actually very successful. And that's everything for today, Adrian.
Thank you, Dr. Munné. Thank you guys for tuning in. Do not forget to like us and leave all your comments below in all the different social media channels on Facebook, on YouTube, on Instagram. We are creating this content catered to your needs, and because Dr. Munné cares about your oral health. And we just want to mention that we will see you next time. Thank you so much. Just